For introduction, I will tell you information about GERD or gastroesophageal reflux disease. It's a persistent digestive condition. It's a cure when stomach acid returns to the tube that connect to your mouth to your stomach esophagus. This can lead to symptoms such as heartburn, chest pain, and difficulty swallowing. Obesity and pregnancy can raise the risk. If not addressed, it might progress to more serious problems. Managing GERD requires lifestyle modification, dietary changes, and in some cases, drug or surgery. If you have chronic symptoms, visit a doctor for accurate diagnosis and treatment. When you eat, food passes from your mouth, then into your esophagus, a muscular tube that leads to your stomach. Our esophagus has a ring of muscle at the end called esophageal sphincter (LES). It will open to let food enter our stomach. Normally, it stays closed to prevent stomach content to going back into our esophagus. If the esophageal sphincter open all the way, it allows gastroesophageal reflux or GERD to happen. The weak or relaxed sphincter allow the content of our stomach to reflux or leak back of our esophagus. Acid the stomach will irritate our esophagus. It will cause a painful burning feeling in our chest called a heartburn or acid indigestion. Commonly, gastroesophageal reflux can happen once in a while. However, GERD can happen twice or thrice for a few weeks. You may have a more serious condition if left untreated. GERD can lead to complications over time. For example, you can have esophagitis, where the lining of your esophagus become inflamed or irritated. Your esophagus may become narrow, which is called esophageal stricture. Factor causes GERD disease. First, obesity. Obesity can increase abdominal pressure, so acid content in stomach is too high. It will cause esophagus sphincter (LES) back into the esophagus. Second factor is smoking. Smoking can reduce saliva production because cigarette contain chemical irritants such as nicotine. It can affect salivary gland function. Third factor is unbalanced diet. Fatty, spicy food, drinking certain beverages such as alcohol or coffee will increase acid in the stomach. Is taking critical medication. Taking aspirin for long periods of high dose, it can irritate the lining of the esophagus or cause inflammation. Lastly, factor cause GERD disease is laying down after eating. Going back or laying down too soon after meal can allow stomach acid to flow back into the esophagus more easily and increase the volume of stomach acid.
There are several symptoms that can happen to someone that have GERD. For example, nausea. Nausea can lead to damage as well as leave a lingering taste in the mouth as the acid creeps upward. Next is asthma. Asthma and acid reflux often occur together. It's known that acid reflux worsens the asthma and the asthma can worsen the acid reflux. The next point is bloating. Frequent swallowing is common with a sore throat or when stomach acid begins to back up into the esophagus. This may lead to swallowing more air, a feeling of being bloated, and frequent belching. A burning feeling is also a symptom of GERD. Acid literally burns the tissues in your esophagus. If it feels like it's in your chest, it's called heartburn. If it's closer to your stomach, you might call it acid indigestion. The last point is sore throat. If acid rises into your throat, it can make it sore. It might feel like there's a lump in your throat or like it's hard to swallow. Reflux into your throat often happens at night.
Let's proceed to how to prevent GERD. First, we have to maintain a healthy weight. Excess weight, area abdomen can increase stomach pressure that can cause acid reflux. Losing weight through a combination of a healthy diet and regular exercise can help reduce symptoms. Second way is quit smoking. Smoking might weaken the lower esophagus sphincter less and increase stomach acid production. Quitting smoking can help with GERD symptoms and is generally good for your health. Third way is limit alcohol consumption. Alcohol can relax the LES and stimulate stomach acid production. Limiting or avoiding alcohol, especially close to bedtime, can be helpful in managing GERDs. 4. Avoid eat before going to bed. Try to finish meals at least 2 or 3 hours before bedtime to allow sufficient time for digestion and to reduce the risk of nighttime reflux. Last way to prevent GERD is sleep on your left side. This position can keep the lower esophagus sphincter above the level of stomach content, reducing the likelihood of reflux.
GERD surgery. Usually, GERD surgery take place when medication and lifestyle change are insufficient to effectively manage the symptom. The most popular treatment for GERD is referred to as fundoplication. Fundoplication can divide into two types, and the first one is Nissen fundoplication and the second one is partial fundoplication. For the Nissen fundoplication, the fundus is completely encircled in a 360-degree circle around the esophagus. So the partial fundoplication, usually done in 180 degrees or 270 degrees alignment. The fund is wrapped partially around the esophagus. This can happen to maintain some of the less inherent opening and closing capabilities. There are some complications after we do a fundoplication surgery. So the first one is damage of other abdominal organs, then gas bloated in your stomach, and bleeding, pneumothorax. Pneumothorax is like lung injury, and the last one is heart attack.
To summarize, we all know that GERD cannot left treated because GERD can be a result that in several serious complications, including esophagitis and Barrett's esophagus. However, GERD can be treated by medication if lifestyle change does not help the process of curing GERD. From the research that we do, treatment options for GERD include a lifestyle medication, medical management and anti-acid and anti-secretory agents, surgical therapies and endoluminal therapies. They must have a way to treat GERD from being worse to our body and health. So, I hope people who have GERD symptoms needs to consult with the doctor so that they can help you with all the medication and therapies. Last word, GERD can be dangerous to anyone if we do not take early action to cure the sickness.